Leave it alone.
But it's Daddy.
I know who it is. Mummy said.
Hello, Lucy? Hello?
I don't care what Mummy says. Mummy's wrong.
You wear that superstar status on your shoulder. Don't worry, I won't lean on you when I get colder. Send a million copies.
Of course I do. You know I love you. Yeah. All right, I've got to go. What did you say?
I said, how you doing?
I'm doing brilliant. We just set a date, July 25th.
No way. Hey, Jeff, did you hear that? They've set a date.
Yeah, nice one, mate. Good luck.
What's up?
Right. The brilliant news is that we've only got 3 crews on cover today.
3? What's that about?
Yeah, just leave it, will you? I'm hoarse with complaint myself. Nothing we can do.
We'll never make the response times.
Yeah, we will. We'll just work harder.
Yeah? What if we're 20 miles away? Don't be stupid, Dixie. People are going to die.
Oh, thanks for that, Jeffrey. That's brilliant. Well, I've had a word with Control and they're going to screen out all the nonsense, so we're just going to have to do what we can.
What do you come as?
What? I like to be prepared.
What for? The Joker? You look like Batman.
Why so serious, Jeffrey?
.002 to Control. Is that all the information you've got? Unconscious in the street? Oh, by the way, you can slow down, Polly. You're really embarrassing if you crashed on the way. Yeah, 3002 to Control. All received and mobile over. Fiver says it's a trunk.
Here he is. Hello, here we go. All right. No, I didn't make that bet. We still need to check him over, don't we?
Oh, knock yourself out.
We must respect every patient, Jeff.
Oh, come on, mate.
Hello, it's the ambulance service.
Good job we got here so fast, eh? Please.
Oh,
3002 to Control. Unless you want us to sing this bloke a lullaby, this is one for the police.
there must be something we can do. Can we get him a bed in a hostel or something like that? Jeff, why so slow?
We're not in a Batmobile now, love. It's not all 100 miles an hour.
Why are we even here? We've just been here. I thought we were meant to be like, woo woo.
They're my kids.
Jeff!
That's it. Dad!
Hey, what's going on? You okay? Look, I've got to get them to school. They're late.
And you are?
Alan. Evil Uncle Alan.
Jeff?
Just had to go into work early, so I've offered to take them in.
Okay.
We're moving in with him. Mum said. I don't want to.
We told them last night. Look, Jeff, this isn't the time or place. Can we...
Jeff, we really need to go.
Told them what?
Well, it's complicated. Can we talk
Told
about this?
them what?
They're getting married. And I don't want him to be my dad.
What? When?
Jeff, we were going to tell you first, but Sophia overheard us talking last night. So...
See?
Jeff, look, I'm really sorry, but we have to go. We're the only unit nearby.
So, you've got to go. I've got to leave, please.
Dad's got to go, sweets.
No.
Hey. I'll see you later. As soon as I can. Come on. Hey. Come on, I'll talk to Mummy. I'll sort this.
How will you?
Well, Mummies and Daddies, mate, they do strange things, even when they still love each other. I'll sort it. I'll sort it.
Jeff, do you want to...
Right, here we are. Which one is it?
9, other end.
Oh. Fantastic.
Oh, mate, just leave it here. It's only up there.
doing CPR. Don't know if it helped.
How long's he been down for, mate? You know.
I just heard a crash. Found him lying on the floor like this. I was getting a post.
Stuck in MI.
You can't tell by looking. He's not that old, is he?
Father says it is. Can you put that fag out, please?
Does he live alone?
I don't know. His name's Darren. He just moved in. Divorced, I think.
Right, well, you did the right thing. CPR.
Oh, scouts.
You could have saved his life. Here, son.
Okay, charging.
Clear.
Overweight, smoker, drinker, junk food. Just a heart attack waiting to happen. I don't know. Expect the NHS to take care of them.
Sounds like you, Jeff.
What are you talking about? I don't smoke. Charging. No more. Clear.
You all right, mate? Is that your ambulance?
Who wants to know?
It's just you're blocking the road, you know? Any chance you could move it? I'm manic today, you know?
You what?
Yeah, I'll tell you what, mate. You take over here, eh, and I'll just nip outside.
Nah, you're all right. I'll see if I can back it up.
You're kidding me. How about people trying to move it themselves?
Hello? So is someone called Debs? Would you?
Hello, this is Polly from the ambulance service. Yeah, we're with Darren. We're going to be taking him to Holby City Hospital. Well, it's hard to say at the moment. Listen, I've got to go. Listen, don't get upset. We're doing everything we can, all right? Look, I'm sorry.
Yeah, it's often better not to take the call, Polly. Just causes worry and confusion.
Is that yours?
Must be his kid.
And this is a lost cause.
Jeff, he's not even 50. Come on.
All right, come on, Wilson. Not your time yet, eh? Charging. Okay, clear. Come on, mate.
Yes, we've got him.
Yeah? I want a laryngoscope and a size 8 tube, Polly, please. And just want to bust open the champagne just yet, eh? Long way to go.
What do you want me to do with that?
Right.
Okay. Got it?
Yeah.
Yeah. Oh, thanks, mate. Right, I want a smooth drive, Polly, please, not a fast one. Could you get onto the ED and let them know we're coming?
3004 to Holby Control, en route to ED with an MI.
Okay, he's opened his eyes.
Yes!
Darren Miles, BP 80 over 60, pulse 95, smoker. Found collapsed in VF arrest about 20 minutes ago. And this is his daughter, she's fine. I shocked him 3 times. ECG shows 4mm ST elevation on 3 AVF. Intubated at scene, extubated him on the way in. Thanks, mate. I've got to run. Okay. Come on in, you. You been on the wacky-backy, or is this place finally getting to you?
Flies. I hate flies.
Yeah, look, Tess, I'm sorry to land this on you, but, Dad's in ED post-arrest, and the mum's on her way in now, I think. I've really got to go make a call.
Okay, well, give me 2 minutes. Oh, you're a gorgeous little bundle.
Thanks, she means you, kid.
Okay, good. His ST segments are dropping. Good job.
Where's you want him?
Oh, you're in the way, sweetheart. How can you not be busy? But okay, we've got a 35-year-old motorcyclist who's been involved with a collision with a van. He wasn't KO. GCS was 15 at scene. BP 110 over 60. Has everyone got a bit? On 3, please. 1, 2, 3. There we go. Query fractured right femur, and his airway is clear.
Hi there. I'm Dr. Truman.
They tried to make me go to rehab, but I said no, no, no. Yes, I'm black.
You were right, it was an MI.
What?
Nothing. It's just nice to see you going the extra mile.
Okay, I'm back.
Isn't that nice? So nice you think it's nice.
Good.
No, Lucy, I don't want to talk about it later. I want to talk about it now. No, I'm perfectly calm, love. I'm not shouting. No, you're not listening. I don't want to talk about it later. I want to talk about it. I'm not shouting!
Yes, you are.
Lucy! Hang on. He just wants to get my attention, that's all.
Well, it worked.
Oh, come on, mate! What are you playing at?
He's learning to drive.
Come on, I haven't got all day!
God. Thank you. There's nothing on the sat nav.
No, it's useless down here for some reason. I don't know why they number these places properly.
Ah, here we go.
You don't know anything, no? No? Okay.
3002 to Holby Control. Any more information reference RTC? Nothing found. Over.
Why do people do this?
Holby Control 3002, male patient found collapsed, junction of Green Street.
I bet you a fiver I know who that is.
Well, we're going to have to check him over again.
Pretty my guest. See, Plod would have told him to move on. He'd have wandered away until they pounded off, and then he'd have settled down again for a nice little kid. There's nothing wrong with him, trust me.
All right, hello. It's us again. Okay. Can you see me? You're battered, aren't you, mate? Ooh. Yeah, nice.
And now we can find out if he's pregnant.
Oh, get lost.
3002 to control. 3 units covering this city today. I've spent half an hour with the Invisible Man and 10 minutes with Piss Pants McWhiskey.
You're all right, aren't you?
How can I do my job if you won't do yours? Over?
Jeff, they only know what they're told. We're going to try and find somewhere nice and warm for you to stay, okay? Yeah. Oh, wow! Awesome! Chevrolet Camaro, 1967. I think it's the 383.
Yeah? What's awesome about it?
Jeff, if you have to ask, I can't explain.
Hello?
Yeah, come on in, mate. Just trying a bit of DIY. I slept and the hammer fell on me.
You don't have to go to hospital, do we?
Well, I think you might, love. You have to be careful with head injuries. So, you say the hammer fell on you, yeah?
Yeah.
It looks like you got more than one blow to your head, mate.
Yeah, well, I hit stuff on the way down. Trying to make bunk beds.
Okay. Holly, can you get me a pressure dressing, please?
Yeah. So you were making bunk beds?
We meant to be moving. Bigger house.
Yeah, but then he got fired.
Made redundant.
I like your Camaro.
Yeah, well, needs a bit of work, though. I bought it in the States about 6 months ago.
Yeah, and that was just before you got fired. And I told you not to buy it. I know a guy who'll take it off you. Give you top dollar for it, too. And what do you get out of it? Oh, well, nothing. Just helping.
It's not for sale.
Okay, mate. I think we're going to have to take you in, okay?
Well, I ain't going. I'm staying here with the baby.
Good.
Okay, Roy, you're going to have to level with me, son. I've counted 4, maybe 5 depressions in your head. So why don't you tell me exactly what happened?
I fell.
What, into a box of hammers? What's this muppet up to?
Right! All right! That's a very serious injury you got there, mate! Come on, Polly!
Roy, come on! What happened there?
I got too close.
What do you mean?
Well, it's obvious, isn't it? They've had a row and she's done him with a hammer.
Yeah, something wasn't right, was it?
Just can't deal with it, that's all.
Elderly lady, lives alone, name is Rosie. Neighbours heard cries for help.
Fine, mate, what's from you? 5 or 6 is a tip.
Jeff, it's so judgmental just because she's an old lady. Oh.
Thanks, mate.
Hello?
Hello? Ambulance service?
Hello?
Hello, anyone in?
Hello? How long have you been down here? Come on.
Okay, love, come on then. Let's get you sorted. All right, mate. I'm going to turn this off, mate. All right, well, come on. Okay. All right, let's have a look at you. You just want to squeeze my hand for me, sweetheart? I think I've got a stroke here, Polly. Can you get me some O2, please? Clear some space and get us a chair in. All right, darling, I can't leave you like this, can I? I'm going to have to get you to hospital, I think. Polly, O2, please.
Jeff, I haven't got it. It must be in the ambulance.
Just go. Go, now.
All right.
Okay. Let's get you sorted.
I think we're going to need your help to get her out of there.
What, in there? Can't we wait for the fire crew to do it?
No, because she's had a stroke. Now, there's a chance we could administer some clot-busting drugs, but we'll have to do it within 2 hours.
You don't even know how long she's been down, do you?
What, so we just give up on her? Is that it? Jeff, I can't find the oxygen. It's gone, seriously.
Have you called for a spare?
3002 to Holby Control. We need a spare oxygen cylinder. Over.
Okay, Polly, on 3, please. 1, 2, 3.
Okay.
Okay. Are we on? Yeah. Nice one. Okay. Can I just take this, my love? Thank you. Okay. Oh, that's nothing to do with me. That's your drugs money, isn't it?
Sorry about that. I thought it was the kids, yeah.
Yeah, I know. It's a bit rough around here, eh? Okay. Is there anyone we can call for you? Family, friends?
Only my son, but he doesn't go anymore.
Okay. We'll take care of you. Do you know how long you were lying there?
Breakfast?
About 2 hours, yeah?
This place stinks.
Hey, shut up.
I didn't mean it like that.
How she lives is her business. She didn't call a lifestyle coach. All right, come on in, princess. Let's have you.
So what happened to yours? Did you leave it at the last shout?
No, I can't have.
Someone nick it.
I don't know what happened to it, okay?
Jeff? Jeff, mate, I wasn't having a go.
Come on, Polly, let's go.
Whoa! Whoa! What are you playing at?
I caught my thumb on the chair.
Okay. Let's have a look. this? Oh, Jeff. Sorry, mate.
Hi. Come on, Polly. This is Rosie, found collapsed at home. She's got a hemiparesis on the left side, has been struggling with her speech. She's also been incontinent. I'm not sure how long she was down before we got to her, but I suspect less than 2 hours.
Thank you. Be careful with her bag. It's a lifesaver, I think.
Right.
OK, let's set up for a CT as soon as,
Well,
please.
the pass slide, please, mate.
Oh, not long now.
Oh, get a room.
Oh, tell her.
What?
What you just told me.
Well, after the wedding, when things have settled down a little bit, I was thinking about going for my paramedics exam.
Oh, fantastic, Curtis. Very good news.
Oh, this is nice. All got time to stand around then.
I feel sorry for him, Dixie.
You didn't say that, did you?
No, of course not.
What did he say to you?
Precisely nothing.
You know, Jeff, everything's cushy till it ain't.
Do you know how serious this is, Dix? I mean, his wife, is she coming back?
Well, it has been going on a while, but he's got these blind spots, you see. If he didn't see it, he won't face it.
Poor Jeff.
No. He's going to be just fine. Come on, you two. Come on, Meg.
What?
Right, you don't have to do this on your own, you know.
If you ever want to talk.
Or go for a pint.
Or watch a match?
Yeah, well, I don't think it's come to that yet.
What?
She's just playing hardball, that's all. Well, once she thinks it through, breaking up the family. You know, I can't believe that she'd actually.
Oh, that's brilliant news. Thank you so much. Thank you. Bye-bye. Jeff, at St. Stephen's Refuge, we've got a spare bed for the night. You see? All sorted.
Well, he won't thank me for it.
Is that a kebab?
Yes, with extra chili sauce and extra chips. If I didn't eat chips, I'd starve.
For Rosie. No, I bet it's a bet.
Bobby Control to 3002, male patient found collapsed in Building Square.
Better not be. Great. And I bet my kebab's gone cold.
We could take him to St. Stephen's because it's on our way, isn't
Oh,
it?
You're wasting your time. Just get onto Plod and tell him to take him in this time. Yeah, all right. Good effort. Good job we were here.
Jeff, I'm just going to go and check on Rosie.
Yeah, Holly,
What?
No, nothing.
Okay, so her BP's come down a bit. There's no evidence of any previous CVA. But no reason not to thrombolyze.
Except she's been down for 3 hours.
And why should that be a problem?
Because it's one more than the 2-hour window.
Except it's a 4-hour window now. You must know that.
Yeah. Don't worry. Stop preening.
So I've cleared 4 cubicles and I picked up those blood gases for your patient. If there's anything else you need, Mr. Jordan.
Really?
Don't know what you mean.
Hi. Just came to see how Rosie's getting on.
Yeah, very positive. We're giving her some clot-busting drugs. We'll see how that goes, but I'm hopeful of a full recovery.
Oh, Big Mac. I think she's looking at you.
Ah, well, you can't blame her. They've obviously still got it.
You sure that's wise? Getting emotionally involved with a colleague? I take it you haven't told her.
She'll cope.
Thanks, Wayne. Okay. Rosie, I'm just going to move your bag. I'm not taking it away, though.
Is Darren's baby, is it?
He arrested again, never recovered.
Polly, come on.
Where's Darren? He died.
Well, there's plenty more where that came from.
What, people?
No, death. Get a grip.
Why don't you care? Debs, I'm sorry.
Who are you?
I'm Polly. We spoke earlier on the phone. We looked after Darren.
No. No, you didn't. Perhaps if you'd got there sooner than you...
Well, I'm so sorry. I didn't mean
Well,
anything.
stop saying sorry. You didn't even know him. You let him die. What are we going to do now?
Should we get going then?
I taught my kids to ride their bikes here. John took weeks, of course. Sophia picked it up in about 10 minutes.
Do you still love her, Jeff?
Yeah. Yeah. Of course I do.
What have you told her? Just plain and simple. Just like that. Does she know? It's what I'd want to hear. I'm only saying.
Get in.
I didn't mean now, Jeff. Jeff, I didn't mean now! Jeff, don't.
Stay in the ambulance. It's got nothing to do with you.
Well, don't do something you're going to regret.
Well, it wouldn't be the first time.
What was that?
Right, I'm stopping this. Well, mate, this isn't your decision.
Mate. I'm not your mate. Why are you doing this? Hey? You've only known her a few months. Why are you taking them away from me?
Did she tell you?
What? Hey? Told me what?
About
What
going,
else is there?
about going away. This is why we're getting married. This is a new start. I've been offered a new job in London. Jeff, please calm down.
I'm perfectly
No one
calm,
is trying
son.
to take your kids away from you. We can work something out.
How? How? Work something. How, Brains? When you're 200 miles away, how do I get to see my kids then?
You'd rather they stayed with you again? With your hours, who's going to look after them, Jeff?
Hobby control to all units. Hobby control to all units. Can you be available for an explosive incident in Radcliffe Student Halls? We're treating this as a Majax.
Look, this sounds serious.
Do they know? My kids. About you moving away.
I told you I don't know what she had.
Jeff! There's been an explosion. Student halls. We need to go now.
Listen, I know how you feel, really, I do, but this, behaving like this, it's not going to help you, Jeff. Really.
Jeff, you can't just... Well, I can't ignore what happened.
Yeah, you can.
OK, you're clear to enter. Something flashed over. Walking wounded over there, a few still inside, one refusing to leave.
OK, mate, thanks. Could be chemical, nuclear, biological, anything.
Nuclear?
Yeah, all kinds of materials available in the university.
Not got any details. Oh, God, it's a bomb.
Yeah, and where there's one.
IRA used to do that.
Are you guys being serious?
Of course we are. That's the joy of this job. You never know what you're going to get next.
Dixie.
What? Nothing. Okay, sweetheart. Well, let's get you out of here, darling.
There's something in my leg. Oh, God.
What?
No! No, please.
Right, fellas, we're going to need some dressings down here.
Hello. Okay. Jeff? Jeff, we're going to need a gel pack in here.
Bang and my wall came in.
All right, I'm Polly. If you can just hold that on your face, it's going to help with the pain. Just sit on the end of the bed for me. You got any other injuries?
Just my face, I think.
Right, your pupils are quite constricted. You sure nothing else hurts?
No.
It's not as bad as it looks. What? Hold this there.
Rich, I'm so sorry.
It's not your fault, Tom. Does anyone know what happened to you?
Can you keep that to your face, please?
Rich,
Come on, let's get you to treatment.
have you seen her face? Have you seen mine?
Right, I'm gonna need a ball.
Look, do something.
You got a displaced kneecap. I'm gonna have to take you in, mate.
No, now, please.
Okay. Well, I've done it before.
We're not trained to do this. What if it's fractured?
I'm pretty certain it isn't. Anyway, you'll be in hospital soon enough, mate.
Do something, please.
Help him. Okay, son. Happy thoughts, eh?
Ah!
There you go.
Right, you need to go to hospital and I need to take you.
can't.
And every second you delay puts other people's lives at risk too.
Can't.
Right, son, take your time. No rush.
I'm all right. I want to see Rachel. No, you don't. I want to see Rachel.
Leave her alone.
What are you talking about?
Do without the extra work, thanks.
He broke his nose.
You playing at? What's that?
An oxygen cylinder. Valves open. We must have been full of the stuff.
All right, listen, keep your head forward for us.
What's wrong?
My fingertips are tingling. It's weird.
Okay, you're probably just reacting to the shock. You might have hyperventilated. Can you find a paper bag? We can get you to breathe into that.
Yeah, I'll get one.
It's okay.
What gives?
Panic attack.
Whatever it is, it can wait. And if it's an apology, you can... No, she's not with me. Well, what do you mean? How could she have gone missing? Okay. I'm on my way. Hang on. Polly. Look, are you okay here?
I was getting weird pins and needles in my fingers, but it's going now. Actually, it feels kind of numb.
Did you clear her neck?
Yeah, of course I did.
Okay. Okay. Did you fall over, or did something hit your neck?
No. Well, I stumbled back when it went off, yeah, but it was backwards into some shelves. Yeah. I did. How did you know?
Okay. You wiggle your fingers for me. All right. Shrug your shoulders.
That's nothing.
What have you taken, love?
Nothing. I don't. I wouldn't.
Okay. I'm going to ask you some questions, and I want you to answer me honestly, okay?
Oh, that hurts.
Can you get Dixie, please, Polly?
Yeah.
Now. Easy.
Listen, mate. I mean, whatever it is, you know, if there's something stuck where it should have been.
What are you talking about? Of course there isn't.
Dix, Jeff needs you in trio and it's urgent. I'll take over here. Right. You've wasted enough of everyone's time.
No!
Is that it? Is that all it was?
Look, I'm not gay. Okay, I'm not. I'm not gay. They're not mine. They're research for an essay.
Mate, we couldn't care less.
Polly, come here, sweetheart. Okay, that's good work, but we've got to be respecting the patients at all times, okay?
Jeff? Midline neck pain, altered sensation.
Okay, sweetie heart, we're gonna have to get you into hospital.
Look, what's wrong?
Well, we think you might have injured your neck. You all right, pal?
No.
Can you get onto the ED? Let Tess know she's coming in. They should be ready for this one. I want to go with her.
Look, there's no room for both of you in there.
I'll stand.
No, I'm sorry. You're going to both have to stay here.
No, don't go.
You are?
Yeah, Sophia, she's gone missing. She wasn't there at the end of school, and she's really upset about...
She's just gone to a mate's or something. Okay, you just go, mate. We'll cope. Go on.
What's your accent?
Marple.
Same.
No way. What's your name?
Devereaux Evans.
Like the solicitor.
It's my dad.
And you're studying law? Oh, okay. You must be really clever. I couldn't do that, you know.
Me neither. I had to resit the first year. But Dad says he won't let me fail.
It's nice that he's so supportive.
Yeah.
Just gonna put this back over.
Okay, this is Rachel Devereaux Evans, 22. She's been involved in an explosion. She's got a midline neck pain with altered sensation. BP is 80/60, pulse 60, SAT's 99, and that luteal saline is to keep a vein open.
Can't move my fingers properly.
A low pulse and a BP that low, we're looking at spinal shock, surely.
Tess, can we set up for a lateral C-spine and an MR assessment, please?
Can you stay with me?
Here's your bear.
You might want to hold on to that. We need to log roll.
Don't let anyone take it, will you?
I promise. Okay?
Oh, she's not Carly's, no. You know the kid down the street? See my mate down the street, she's not there. There's a fight with her. Hey! Taxi!
Yeah, it's a fracture at C3 with adjacent cervical hematoma. My guess is it's unstable.
I'll get someone down from neuro.
Yeah, quick as you can, please. She's dilated. That's why her BP's so low.
Can we squeeze
Can you tell me anything, please?
Not until she's been through MRI and we have a clearer picture. It's not looking good, though.
Monitor her venous pressure once we've got that CVP line in.
Doctor, will she walk?
We can't make that judgment yet. There's bleeding to her spinal cord. The pressure's causing the paraplegia.
Well, can you stop the bleeding?
It's doubtful. We'll have to wait for neuro. Surgery's her only option.
But then, even if you... I mean, will she be all right? Will she live?
I want my dad. Can someone call him?
Okay.
Now!
Someone's gone to contact him.
I want my dad!
Okay, Rachel.
Can someone talk to me? Tell me what's happened!
All right, try and stay calm for me, please. Okay, we're going to put a little line in just below your neck here because we need to monitor your blood pressure a little more closely.
No one could have seen it, you know. Not without an X-ray.
Well, Jeff did, and you did.
Only when her fingers started tingling. And Jeff's so much more experienced than you. And that allows him to be more detached as a result, which means he can be more analytical. Look, sometimes a hug's a good thing. Sometimes it means you're too close to see the patient properly.
I'm sorry.
It's not about sorry.
How's the lad, the one with the knee, the splinter?
The gay one. Took him to St James's. He was mouthing off about suing someone, but I soon put a stop to that.
So that's at 85%.
No, hypoxic.
That's the pressure increasing on the cord. I think we should RSI, yeah? Yeah. Okay. Test. Propofol and socks, please. Okay, Rachel, we need to help you with your breathing now. To do that, I'm afraid we're going to have to put you to sleep, all right? Just try and stay calm for me. Right, you want to do cricot for me?
Mm-hmm.
Right, folks, this is going to be a tricky intubation. Her neck's immobilized. I don't want to move any more than is absolutely necessary.
Yeah, mate. You haven't seen a little girl, have you? About 8 years old, named Sophia.
No, sorry, mate.
No?
No.
Okay. Okay.
I can't see a thing. There's too much swelling.
Do you want me to try?
No, I'm fine.
She's in PEA.
Is there anything I can do?
Yeah, keep out of the way, please. Okay.
Bye.
Did you call Euros?
I'll try them again.
She had a broken neck. I gave her a paper bag, Dixie.
Oh, she had distracting injuries. There were no clinical signs.
It was just a party, just trying to have some fun. No, it was you trying to get her off her face so you'd have a chance with her.
Did you wear gloves?
What?
When you stole the cylinder. Because they'll check it for fingerprints, and I'm going to suggest that they try you two for a match. You were trying to get your hands on the Entonox, weren't you?
Yeah. It's better if we confess, isn't it? I mean, it'll look better in court. It was only an accident anyway.
Tom, shut up.
Yeah.
There's been a slight problem. It's Rachel's.
No wonder she didn't complain of any neck pain.
Yeah, that's not all, I'm afraid.
Needle stick. Right, you need to wash out the wound.
Can you not tell the others?
It's your call. We need to check her blood. At least access won't be an issue. We need to talk to occupational health about possible PEP treatment, but at least you're up to date with your Hep B and tetanus cover.
What about HIV?
Hepatitis is more of a concern.
Hello. Hi. You're looking so much better.
Yes. Thanks to you, though. Thanks for not giving up on me. Sorry I hit you.
Oh, no damage done.
A few weeks ago, these kids were messing about, trying to get in. Mackenzie sorted them out.
Oh, I just happened to be walking by, you know. They was only young lads. Hey, I knew where to get that money in the bank now, innit?
I know. He's always going on.
Polly? These were left for you.
Bye.
Sleeping Beauty over there. Hey, gotta take your pleasures while you can.
Hello. Now, I'm only going to accept these if you promise to go to St. Stephen's.
St. Stephen's?
Yeah. They'll give you breakfast and a shower.
Holding control to all units. Male patient found collapsed following head injury. Graceland, Wilburn Terrace.
cycling. You know, rather than driving that rust bucket, I thought you were an eco-mentalist.
Yeah, I am. And by driving that rust bucket, I stop a new one from being nicked.
Doesn't matter. It does 2 miles to the gallon then.
Is she all right?
Yeah. No. But she's with her mum, you know.
You know, if there's anything that you need, anything I can do,
Well, right now I need another drink. Another curry and another drink.
that I can do.
Thanks for putting up with me today.
I think that's my line.
Nah, you're all right. Bad girl.
Yeah, maybe I can lose that belt.
You all right, mate?
Yeah. Yeah, well, apart from the bit where I get divorced. I'm not having my kids, though. Right. Nah, it's all right. I'm right around.
Actually, I'm a bit short. I don't know what happened to all my cash.
Some white boy fleeced you. Hey, what happened to that girl, that Rachel?
Oh,
Sorry, man.
Happens to all of us, doesn't it, kid?
You'll be fine.
no, actually. Needle stick. Rachel's teddy bear had a syringe in it.
So she was a user?
Where?
Nah, it's nothing. I got 2 there. Look, 1 there. I got 1 there.
Yeah, and I sat on one once. I'm not showing you that.
Packing in the laughs next here on BBC One. It's brand new Michael McIntyre's Comedy Roadshow.